Hi everybody, this is Nursing 135, head to toe assessment. So Sarah and I will show you how we would like you to demo the final exam for us at the end of the quarter. Okay, so I'm going to get started, and there's going to be moments that we can probably pause and you can ask me questions later on about the video if something is unclear. So we're going to get started. Okay, so I'm just outside the room. I have my equipment all gathered with me. I have my pen light. My pretend robo nurse is right here to take vitals, although we know that we're going to omit vital signs for this testing. You're just going to verbalize that you will do the vital signs testing, okay? So I'm going to get started. I'm just outside the room. All right, and Sarah's just going to sit there until I tell her to lay down. All right, here we go. Knock, knock, knock.
Come in.
All right, I'm providing for privacy. I'm gelling in. Hi, good afternoon. My name is Kay.
Hi.
I'm here to do a set of vital signs, and I'm also going to do a general survey and perform a head-to-toe assessment.
Great.
Okay, so but first, may I please verify your name and date of birth?
Yep, my name is Sarah Maritsky, and my birthday is July 4th, 1980.
Okay, thank you, Sarah. Are you having any pain at the moment?
I'm not.
Okay, so from 0 to 10, can you rate your pain for me?
0.
0? Okay, so what brings you in today?
I'm here for a wellness check.
A wellness check. Okay, are you experiencing any emotional or physical distress?
I am not.
Okay, and can you tell us approximately what time of day it is?
It is probably 2 o'clock in the afternoon.
Okay, and where are we exactly?
We are at CBC Hospital.
Okay, and do you have any spiritual or cultural considerations I should be aware of for your care?
I do not.
Okay, and is English your primary language?
Yes.
And you won't be needing an interpreter
No,
then?
thank you.
All right, so I'm going to go ahead and do a set of vital signs on you. Okay, I'm going to be right back, Sarah. I'm going to document this and be back to finish your head to toe.
Great.
All right, so for the general survey, this is my patient, Sarah. She is here for a wellness check. She appears to be in no emotional or physical distress. She is alert and oriented to person, place, and time. She's answering my questions appropriately in English, and she does not require an interpreter. She is well-dressed, groomed, appears neatly, dressed appropriately for the weather. She does not appear to be cachexic. She is height-weight proportionate. She is not dysphasic. She doesn't need an interpreter. Her vital signs are within normal limits. She rates her pain as 0 out of 10. And she has no cultural or spiritual considerations I should be aware of. Okay, knock, knock. I'm gelling in.
Mm-hmm.
Okay, Sarah, I'm back. I'm going to start your assessment now.
Okay.
But first things first is I need you to remember 3 items, and I will ask you to recall it later.
Okay.
Okay, so the first one is yellow, banana, minion.
Okay.
Okay, so I'm going to get started first with your assessment. So I'm going to start with the skin.
Okay.
So do you have any skin breakdown, lesions, open areas I should be aware of?
No, I do not.
Okay, and if you did, I would wear gloves, but actually I will wear gloves. Since I have to touch you. All right, so I'm just going to start with your face and arms that I can visibly see.
Okay.
Okay, so I'm going to start with your arms. Okay, I'm going to touch you. All right, so skin feels warm and dry. There's no excessive moisture on it. She has a few freckles on the skin that I'll make a note of, and I don't see any open skin breakdown, lesions, no jaundice that I'm noting. And I will continue to assess your skin throughout this assessment. I'm also going to check your skin turgor. I'm just going to pinch right here below the collarbone. Okay, and her skin turgor is less than 3 seconds. Okay, so I'm going to move on to your head now. Do you, on your scalp, have any breakdown on your scalp I should be aware of?
No.
Okay, so I'm just going to start just on your head. So I'm just going to touch here. Okay, head is erect and midline. It is normocephalic and round. Her hair is evenly distributed throughout her head. Okay, her hair is fine. And assessing the scalp, I don't see any lesions, any breakdown. Her scalp is shiny and intact, which is normal finding. But I don't see anything on her hair. Her hair is, like I said, fine, and it's evenly distributed. Okay, I'm gonna move down to your face now. just by looking at you, your features are symmetrical. I just need you to smile for me, and she's really smiling under that mask. So her facial features are symmetrical. I don't see any ptosis, any facial swelling. Normally also I'd ask you to stick your tongue, but but I'll pretend that it's there and it's intact, and like I said, features are symmetrical. I don't see any facial edema, so I'm gonna move on to your eyes. Now, do you yourself wear any glasses or contacts?
No.
Okay, all right. So I'm just gonna check your conjunctiva. Okay, just your lower conjunctiva. So the lower conjunctiva should be pink and moist, and it is. I don't see any redness. The sclera is white and clear. And I also know jaundice on your sclera, so I'm just gonna check your eyes. I can find my pen light here. All right. Ideally, I would dim the lights before I check her pupil, so we'll pretend it's dimmed. So I'm just gonna check your pupil size here. I just need you to look past me, Sarah, and don't look directly at the light, please. Okay. On the other side. Okay. And then, Sarah, I just need you to look at this pen and focus on it as I bring it in and out. So the pupils are approximately 3 millimeters in size, and they are both equally round and reactive to light and accommodation. Okay? So now I'm going to move on to your ears. Do you have any difficulty with your sense of hearing?
No.
Okay? So I'm going to perform the whisper test here in a minute, but let me check your ears first. So just looking with my pen light here, the outer canthus of her eye should be aligned to the top of her ear, and it is on this side, and then also on this side. And if I had to look in her ear, I'm assessing for foreign bodies or any drainage, and she says she has no trouble, you have no trouble with your hearing. So I'm just gonna perform a whisper test on you. I just need you to just say back what I whisper to you. Nursing.
Nursing. Nursing.
Okay, good. So you passed the whisper test. Okay, so now I'm gonna move on to your nose and mouth. Do you have any difficulty with your sense of taste or smell?
No.
Okay, good. Okay, so if I was to visually inspect the nose, if I had to shine the light here, I would be assessing for any drainage, any congestion, any septal deviation, or any septal defect. And normally I would also ask you to breathe one air at a time. Make sure you have no difficulty with your breathing. Okay. So I'm gonna assess next is your mouth. Normally I would make you say ah. Okay. So for your mouth, I am assessing for the uvula being midline. I'm also assessing for any halitosis, any drainage, that the mucous membranes are intact. Do you have all of your own dentition?
Yes.
Okay. I would also be assessing for any broken teeth, any crowns, if there's any, and if you did wear dentures.
Okay.
Okay? I'm trying to think if there is anything else I'm forgetting in the face. All right. It'll probably come to me in a minute. Okay. So I'm going to move on to your neck. Okay? So do you have any problems moving your neck
No.
side to side? Okay. So we're going to assess that in a minute. So I'm just going to check your trachea here. I'm just going to run my hand down your trachea. So the trachea should be straight, should not be no tracheal deviation here. And looking at your neck here, I'm just going to touch you ever so lightly. There's no evidence of any swelling here. There's no tracheal deviation. There's no neck vein distension. And there's no swelling. And Sarah, can you move your head side to side this way? Okay, and then up and down, and then around. Okay, so range of motion is intact on the cervical muscles, and we'll check the rest here with your legs later on. Okay, so I'm gonna move on to your breast assessment, then I'll move on to your chest. Do you yourself do self-breast exam?
No.
All right, so it's important that we do that once a month, especially for females, ideally about 45 days after a period or approximately a week after the period has started, just to make sure that you're checking for any lumps, any abnormal findings under the skin. Ideally, you would do it one of three ways. You either start from the areola like a pie wedge going out, or concentric circles from the areola going outward in a circular motion, or the vertical strip going up and down. Just making sure you're going all the way up to the axilla just to make sure that there's no lumps there. And if you do find any, you need to let your provider know, especially if you're finding out that that's changing in size. Okay. I would also ask you if you've had a mammogram, especially after the age of 40. Ideally, you should get a mammogram. Okay. And if I was to assess your breast right now, I would be looking for symmetry. I'm also going to look under the breast for any skin lesions, any breakdown, any nipple drainage, and rashes. Okay? All right, so we're moving on to the chest. Okay? Are you able to cough for me?
Sure.
Okay. Do you yourself have any problems with chronic cough, congestion?
No.
Okay, so I'll assess that. If I was looking at you, I don't see any cyanosis in your lips, the bluing of the lips. I don't see any of that right now. And then I'm going to listen to your lung sounds. Okay? So you're not short of breath?
No.
Okay, good. All right, so I'm going to listen to your anterior fields first. So first one here is under the collarbone. Okay, nice deep breath for me. Okay, and then another one, please. Okay, so those two is your 1, 1, 2, 2, 3, 3, 4, 4, 5, and 5. And then posteriorly, I would listen here. 1, 1, 2, 2, 3, 3, 4, 4, 5, 5, 6, 6, 7, 7, 8, and 9, and 8, and 9 posteriorly. So I did not hear any adventitious sounds. So your lung sounds are clear bilaterally. No adventitious sounds such as stridor, crackles, wheezing, and rhonchi. And you said that you don't have cough right now. Okay. I'm also going to check for your chest symmetry. So Sarah, if you could turn that way for me. So I'll do it from the back because it's easier. So, all right. So we'll check for chest symmetry here. Okay, I'm just squeezing in the middle here, your skin, and then go ahead and take a deep breath. Okay, good. So your chest is symmetrical with your breathing. It's unlabored. And like I said, there's no cyanosis whatsoever, no shortness of breath. I believe that's it for that one. All right, I'm moving on to your heart. Do you have any chest pain present right now? Do you have any problems with having a murmur?
No.
Or having a fast heart rhythm?
No.
Okay. So I'm going to listen to your heart sounds. I'm not going to put my stethoscope on right now because I have to name the fields. So I'm going to listen to 4 listening posts on your heart. So the first one is the aortic valve, which is the second intercostal space, right sternal border, followed by the pulmonic valve, which is the second intercostal space, left sternal border. Next one is a tricuspid valve, which is the fourth intercostal space, left sternal border, and finally mitral valve, which is the fifth intercostal space, mid-clavicular line. So I'm just going to listen to the tricuspid real fast. And ideally, I'd put this over your skin, not over your gown. Okay, so your heart rate is regular rate and rhythm. There's definitely S1, S2 present. There's no S3 or any murmur that I've auscultated. Okay? All right. All right, now we're moving on to the abdomen. So what I've done is I've asked Sarah to lay down for us. And I've also raised the head of the bed just to save some time for myself. So, all right, Sarah, so I'm moving on to your abdominal assessment.
Okay.
So do you have any difficulty with any nausea, vomiting, diarrhea, or constipation?
No.
Okay. How are your bowel movements?
Normal.
Okay. You don't notice any bloody stools, any
No.
tarry stools?
No.
Okay. So just by inspecting your abdomen, ideally I would have the abdomen exposed here, but so we'll pretend for Sarah. So just by looking at the abdomen on the side, ideally eye level, abdomen should normally be flat, and it is from what I'm seeing. There's no concave or convex shape in your abdomen. And then I'm going to auscultate next. Okay, starting with the lower quadrant. Again, ideally this should be skin to skin. upper and the right lower. Okay. So bowel sounds are active in all 4 quadrants. So I'm gonna palpate your abdomen, Sarah. Okay. Do you have any pain in your abdomen right now?
No.
Also, while I'm looking at your abdomen, I'm also assessing the skin on your abdomen. So if I was to assess it right now, I should not be seeing any breakdown, any scars, any striae, or lesions. If I did, then I would make a note of that. So I'm gonna lightly palpate it, starting on the lower quadrant. And ideally, you'd follow your fingers. Do you have any pain?
No.
Okay, good. Okay, I don't notice any pain, no pain that that you're reporting. I also did not feel any distension. There's no masses or pulsations. There's no tenderness, and there's no guarding that that I can assess right now. Okay. And you said that you don't have any troubles with your bowel movement. Is that right?
Correct.
Okay. Okay. Good. Thank you. Okay. So moving on to your urinary system. Are you able to void or urinate normally without any pain or any blood in your urine?
Yes.
Okay, good. If you were a male, I would ask about testicular exams, but for females, have you had a pap smear before?
Yes.
Okay, good. Yeah, it's important that we do those too, so that way they can monitor if there's anything that's found. So it's good to have your annual checkup, so that way they can assess the pap smear. If I was to assess the GI system, the GU system, then I would assess for the urine color, clarity, and amount. I would also look for any perianal breakdown, any hemorrhoids, or any rash in the peri area. Okay? Okay, so now I'm moving on to your musculoskeletal system. Are you able to move your arms up and down?
Sure.
Okay, go ahead. Go ahead and put it up and down and then side to side. Do you have any pain there?
No.
Okay, so your range of motion is intact on that side. And then I'm going to have you raise your leg one at a time. Hold it 3 seconds up in the air. Okay, 1, 2, 3. And then other leg. 1, 2, and 3. Okay, good. So your range of motion is intact. Okay, I'm just going to check your pulses. Okay, so the first one is the radial pulse. So I have to do it both sides, make sure they're equal and strong. And they should be. Okay, so I'm assessing your radial pulse. The next pulse I'm assessing is the pedal pulse, which is on the top of the foot. Ideally, I would have your socks off, but just for demo, it's just typically right here on top of the foot, and it's right there.
Yes.
I can feel it. And then the last one is your posterior tibialis, which is just right below here on the calf. And if you can see, I'm pressing in here, right behind this bone here. That's where you would find them ideally. Okay? And they're both equally strong with your pulse about a +3, which is normal. All right. So range of motion is intact. I don't see any bruises looking at your legs here. If I'm assessing your legs, I don't see any bruises or any breakdown here. Joint mobility is intact. I don't see any swelling of your joints either. Okay? All right. So I think we'll move on to your neuro. So do you recall those 3 things I asked you to remember earlier?
Yeah. Yellow, banana, minion.
Okay, good. Okay, good job. All right, so we've established that you're alert and oriented to person, place, and time. Okay, your short-term and long-term memory are both intact because you can recall that quite easily. Your speech is clear. Okay, there's no signs of any irrational thoughts, no signs of dementia. We've already checked your Perla earlier for neuro status. And you're able to feel me touching you, which tells me your sensation is intact. Let's see what else is on that neuro sheet. I'm sure it'll come to me in a minute. All right, so for any miscellaneous items, so for you, if you had an IV right now, I would check the patency of your IV, okay? And I would check for any swelling, drainage. If it was infusing, I would trail it all the way back to the IV pump, make sure it's running at the correct rate. Also, if you had a Foley catheter, I would make sure that the tubing is intact, that the bag is actually flowing below the bladder, and it's not kinked. and that the bag is not full, because if it was, we would empty it. And then finally, if you had an oxygen cannula that you're wearing, I would also trail that all the way up to the wall, just to make sure that it's number one on, and it's actually running at the liters per minute that is ordered for you. Okay? All right, Sarah, so that ends my assessment. Do you have any questions for me?
No, thank you very much.
All right, here's your call light, and please call me if you need anything.
Sounds good.
Out, and that's it. Okay, buddy.